You're listening to the Integrative Health Simplified podcast with Kari, Coody, pharmacist turned integrative health practitioner. Here we talk all things straightforward and honest when it comes to holistic health and simplifying your best steps forward while eliminating all the gimmicks and confusion. Leave the overwhelm at the door and get ready for impactful action steps that get to the real root of your issue and actually move the needle in your health. Let's dive into the show. Welcome back into the Integrative Health Simplified podcast. My name is Kari, and we are continuing this series, Conventional versus Integrative Health. And I'm excited to dig into this specific episode because I do feel like we live in the extremes in this a lot and really demonize the conventional system. And so I get it has a lot of flaws. However, there are some things, in my opinion, that the conventional system does right. So I want to kind of chat about that and maybe, again, just to encourage you to look at things in a little bit of a different way. So let's dig into this topic of what the conventional system does right. And just so you know where I'm coming from. So again, I've mentioned this on previous episodes, but maybe you're joining me for the first time. If you are, hello, so glad that you're here. But I do come from the conventional system. I am a pharmacist. And so I worked as a pharmacy tech for about 8 years. And then I worked as a full-time pharmacist for another 8 years. And then I still work part-time here or there, filling in for a local pharmacist. So I do still work in that world a little bit, very minimal. Now, primarily, I am in the integrative health space. And so I look at things more from a root cause, holistic health, natural sort of way. And so I do have an interesting viewpoint from having been in one system and now are primarily in the other. And so that's just kind of the lens that I'm coming from. So I just wanted to make sure you are aware of that. Okay, so what is the conventional system doing right? First off, they run labs. Very often when you go see a conventional doctor, one of the first things they do is they run blood work. And so as someone that uses blood work as one of the first things that I do is as a blood work and hair test along with signs and symptoms, that can tell us a lot. And so I do appreciate that they a lot of times want to run blood work to see what's going on. Now, I understand that they look at blood work a lot differently than I'm going to look at blood work. I'm going to leave that out of this conversation, but I do think that is great that they run blood work because you can catch some things on blood work. I get that they're going to look at things from a much wider lens. And so something is going to have to be way off for them to catch it. However, I do appreciate that they run labs because that allows them to look at your labs. One of the things that, and we're going to talk about this in the next episode actually, is what the holistic or integrative health space gets wrong, in my opinion. One of the things that they get wrong is that there often are so many generic blanket recommendations like supplements or gadgets or things like that can really lead you astray. Like, oh, this is going to be the fix, but they're not. That person doesn't know anything about you. Like they're just sharing what's worked for them, which is great, but it might not work for you. So that is one thing that I do appreciate about the conventional system is they are looking at your labs when you're coming in, or maybe it's blood work, maybe it's some other test, but they're giving you suggestions based on, again, their background, which that's a whole nother topic, but they are looking at your labs. They are giving suggestions based on you. And so I can really appreciate how that is a positive thing. That is something that we've kind of gotten away from in the holistic health space to a degree, because it is easy to share what's worked for me, but that might not mean that it's going to work for you. And sometimes it can actually be of detriment, right? I mean, if we are taking a supplement and it's actually making things worse, then that's not going to be a really big positive because it didn't take the bioindividuality, I guess I should say, of you into consideration. So I do appreciate that they run labs and they look at those and they give suggestions that are based on you. So that's one thing that I feel like the conventional system does right. Second thing I feel like they do right is they schedule follow-ups. They do yearly checkups, right? They want to be with you for the most part on an ongoing basis. Again, in the holistic space, I see a lot of times where maybe you'll work with somebody for a specific time frame. And then after that, that's it, right? It's just for that specific time frame. And this is something that I'm personally very passionate about, because I feel obviously like health is a journey. It's not necessarily something that you can whittle down to a specific time frame. So whenever you sign on to work with me, we have an ongoing relationship. Now that doesn't necessarily mean that we'll be working super closely for years and years and years. We might be, I don't know. It kind of depends on your needs, but that door is open. It's not like the door is open for 3 months and then it's closed and you have to pay more to work with me or interact with me, ask questions, those types of things. And so because I feel passionate about that, I can really appreciate that the conventional system, they do remind you, hey, you need a yearly appointment or a checkup or a follow-up on things. For the most part, I get that there are some offices that don't do that. But for the most part, the system is set up to have an ongoing relationship with you, and that you can schedule things as you need them or yearly appointments. I do feel like checkups are good. They do help catch things. There can be screenings, like age-appropriate screenings that they do that can help catch things. This is a good thing, in my opinion, because, again, it would be great if we all knew our bodies extremely well and knew when something was off very early. However, a lot of times this isn't the case because we're not very in tune with our body. And so these age-appropriate screenings can be really helpful whenever something is off and we don't really know it. So it can really help detect things and catch things. I get that you could argue that there are flaws with all of these things, and I'm not going to argue with you. However, I'm pointing out the good. I want you to see the good in these systems that are set up within the conventional space. So that is the second thing that I feel like they are doing right, is the checkups, the follow-ups, the screenings, those types of things can be really, really helpful for us. Another thing that the conventional space is doing right, in my opinion, that us in the holistic space can kind of take note of, is that they do have sort of like a shared decision-making thing going on. They have specialists or other health services that they can kind of reach out to, get their opinion, sometimes refer people to. Of course, there could be downsides to these things. I get that. However, they, really it's set up for you to have a primary doctor that has given you a full, you've sat down with for a length of time and shared what's going on, and they've run some labs and things like that, and they've kind of got a good assessment, and they can see, okay, she's really having some, endocrine type issues. So, bringing in an endocrinologist that knows a lot more about that could be really helpful. And so, again, there are flaws to this, but I do think that is one thing they do right, versus kind of everybody feeling like they need to know everything. That's sort of what we can sometimes do in the holistic health space, is think our way is the only way, the right way, etc., and not necessarily pull in other people to get their opinions or to really tap into their specialty. Because some people, so just for instance, some people like myself really feel called to more of, I guess I would put myself more in the category of like a general PCP type. If I had to make a, kind of a parallel with the conventional health system, like I want to be someone that people can, come to that are having issues. I can, take everything into account and kind of give them a really good start to getting their foundation back in order. I can, help them, just kind of alleviate some of these issues. However, where I see that I'm trying to go in this direction, but sometimes it takes a little bit of time, is I want to bring other people into my online practice that do specialize in other things, like maybe like pre and postnatal care, nutrition, thyroid, gut, hormones, those types of things. So that, if say they come to me and we're going, everything's going well, right? They're feeling better, but yet I know they need more help in this area. And so I can kind of get somebody else to come along and walk beside me, and we can have this really good relationship as far as they're going to keep me updated on this patient. We're going to make shared decisions even, but they are way more trained in that area than I am. And so it just helps me to obviously have not feel overwhelmed as far as like, I need to know everything, right? There are people that know way more than me in the holistic space about these different areas. But I don't necessarily feel called to only focus on one area. So again, I think it's leading to, as far as looking at a practitioner in the holistic space, I feel very led to this area, but other people feel very led to their area of expertise. So I don't feel like, though, we have a lot of collaboration when it comes to the integrative health space. And I really want to see that more. So again, I'm just sharing with you one of my dreams and goals is to have more of a community online that we can do this together. But I do see the conventional health system doing that. And so I do feel like that is a bonus, and it's a good thing for the patient because, again, you want them, this is in the best case scenario, right? The PCP wants them to, that's the primary care provider, that's the like kind of the general doctor that they come to and then get referred out from. You want them to send you to someone that does specialize in some of the issues that you're having, that can give you a little bit more of a specialized approach to your issues and hopefully, obviously, get you back going on the right direction so that you don't always have to go to them. You can maybe just come to your primary care physician and, get maybe some check-in types of things in the next few months or years. But again, these other health services specialists can really help in shared decision-making so that you can get the best care that you need. And so I see that working, for the most part, pretty well in the conventional health system. Again, there are flaws to all of these things, just like there's pros and cons to everything, but that is one thing that they are doing well. And so I hope this conversation just, again, helps you to see things maybe in a different light. Maybe you've really put the conventional system in this box that they do everything wrong, which that's not true. And I think that oftentimes just because maybe we would do things differently, sure, I would do things differently than, and I do things differently than the conventional healthcare system. However, I do think that I'm as a practitioner and as a patient am not necessarily doing anybody any good if I put them in a box that says everything that they do is incorrect and wrong. I can't learn from them, right? I can't see what they're doing right and try to bring that over into what I'm doing and what I feel called to do. And as a patient, you can't really do that either. Maybe you're dealing with a health issue and you're really just trying to do it the natural way. I fully understand that. However, sometimes we need to go the conventional route because we need to know what's going on. And there's nothing wrong with that. Maybe we need some type of prescription medication. There's nothing wrong with that. I think that sometimes these things they're really shamed and demonized in the holistic space. And I really hate that. I don't like that. I think there's a time and place for almost everything. And so this is a conversation that can get really heated. But again, I think that it's because we have this extreme mentality and it's either good or bad. There's no in between. And so hopefully this has helped you to look at things a little bit differently. And again, it sort of all goes back to this conversation about how every single person is unique. And so what's worked for one person might not work for you because you're a little bit different than they are. And so I think sometimes when we, maybe we're looking to see what someone else is doing and it's really worked for them, but it's not necessarily working great for us. Again, there's so many different caveats to why it might not be working. However, this might be what you need to do is to go to a conventional doctor and get checked out. And I think there's absolutely nothing wrong with that. And there should be no shame around that. And it's not that it's not that holistic or integrative health doesn't work. That's not true. It's simply that this is the next right step for you and you need to go see what's going on. Maybe there's nothing going on, but maybe there is, and you need to get checked out in a different way and get somebody that is more trained in, the certain issue that you're having to look at it and see what's going on. And then you can come back knowing way more and do more natural things. Or maybe you need to add in a prescription medication that's really going to help you in the interim, right? I think that all of these things can be okay and there should be no stigma around that. But oftentimes there is, and I get that. However, we have to do what's right for us and we have to let go of the opinions of others. And so I hope that if you're listening and you're like, man, I'm really resonating with this. So, again, so much of this goes back to just going to the Lord and asking him, like, if you're confused, ask him to give you clarity, ask him to guide you to whatever is going to be the right next step for you. And kind of try to forget about all of the big picture things and just take it back to, like, what's the next right step for me to do right now? Don't think about all of the future and all the what ifs. Like, sometimes we just need to take it back to, what is the next right thing I need to do today, this week, this month, and kind of forget about the bigger picture of things. And so I hope you feel encouraged in that. Again, I always want to and love to continue the conversation on these things that I bring up in the podcast. I try to keep these episodes sort of shorter, but that doesn't mean I don't want to talk about this more. I love to talk about these things. So email me, DM me on Instagram, however is easy for you to get in touch with me. I would love to hear your thoughts or questions or whatever you might, have that you want to chat about. I'm all ears. I love this stuff. I feel very called to this. So please don't hesitate to reach out. See you guys on the next one. If this episode has served you in any way, I would love it if you'd share any aha moments or takeaways over on Instagram and tag me at Kari Coody. And if you haven't already, hit the subscribe button so we can continue to learn and grow together.